Hi, welcome back. This is Gerald Major from the Canadian Spondylitis Association, and we're here on the Arthritis Broadcast Network, hashtag CRArthritis. I'm here today, pleasure to be here today with this young man, John Chan, from a local rheumatologist here in Vancouver. So I'm wondering, first of all, thanks for being here.
My pleasure.
If you can, just introduce yourself, a little bit about what you do around rheumatology, and we'll go from there.
Sure. I'm a rheumatologist practicing mostly in Vancouver, although I do some clinics in Surrey as well, which is a local suburb here. And I do general rheumatology, but also have a focus on ankylosing spondylitis, axial spondyloarthritis, and psoriatic arthritis. So I do clinical work and try to do research, and also a little bit of clinical trials as well in those areas.
So tell us a little bit about your community.
Yeah, so in BC we have the fortune and the blessing of having nurses in our clinics. Almost all of us have extra help, and so they really help deal with a lot of issues that we know make a difference, but in a busy practice are hard to do. Or you'd spend an hour per patient, when you really can't afford that kind of time. And so things like making sure the vaccinations are up to date, the smoking is stopped, weight loss, addressing mood, things like that, the nurses are really great at. And I have a physiotherapist in my office who did an extra training in inflammatory arthritis. And so she helps me with screening for patients. So typically if you have, I think most rheumatologists, if you referred to them for back pain, a young person with back pain, it could take anywhere between quite a few months to get in. But with our physio's help, we can identify these patients, and I try to prioritize them because of my clinical interest, and we see them within 2 to 4 weeks and get them on appropriate therapy as soon as we can.
So you're a bright new face into rheumatology.
Yes.
I wish I was that young. There was an interview that I had earlier today where Walter Maximovich
Yes.
wished that he was 20 years younger, just to see where we're going with medicine these days and treatments. And so talk about the benefits that you see as being young and this kind of situation that we're in right now. I mean, I've been here maybe 2 years, and what I found is I'm able to see things kind of change and happen, whereas otherwise I may miss it. So talk a little bit about that.
Well, I think we were just chatting beforehand that the last 10, 20 years, it was rheumatoid arthritis' time to shine. And in the last decade or so, it's more seronegative spondyloarthritis and psoriatic arthritis. A lot of the new clinical trials and medications that are coming out are specifically for these indications. And so I think our awareness is growing. There's been some data out of Toronto showing increased rates of diagnosis. And it's not because it's happening more frequently, we're just picking this up more. And frequently we'll see patients who say, I've had the average delay in diagnosis from symptom onset for spondylitis is 10 years. And so, we're shortening that gap because we're more aware of it, and we've got better tools to identify that now.
So I'm a pre-biologic patient, really. I mean, symptoms at about 1986. So a lot of the surgeries that I've had is repairing damage that's been done over that time. What are you seeing, and how fulfilling is it to talk with young people, diagnose them quick, and getting them on treatment?
Absolutely. So, the treatments we have in spondylitis particularly are, I'm not exaggerating when I say life-changing. A lot of patients I've seen, for some people it may give some benefit, not as much as we'd hope, but for a lot of patients you'll see, one of the reasons I went into rheumatology was seeing my best friend. He has spondylitis, and he went from he was on crutches for 3 years, unable to walk. He's a doctor, and he was debating about whether or not to stop medicine, and now he does marathons. He does the Gross Grind twice a week, which is a kind of an intense hike. So the quality of life that's afforded is much better now, and there's data that if we can catch this early, their chance of response is better. There may be some prevention of this fusion that happens in some patients, but not all patients of spondylitis. So it's an exciting time for spondylitis.
So I met you through SPARC, the Spondyloarthritis Research Consortium of Canada, and I mean that's where a lot of my physicians reside, and I love the group. So talk about what drew you there, and outside of the personal experience and what you're seeing from these guys that we talk about.
Yeah, so when I was training in rheumatology, I knew I wanted to do spondylitis, and the opportunity arose where our program was looking for someone who could specialize in that area. So they asked me if I'd be interested, and thankfully I connected with Rob Inman and Nigel Haroon in Toronto, and did spend some extra time with them and tapped their vast knowledge in their brains, and got participating in this Spark, which is a research group, and so we enroll patients who have spondylitis into this national database, and we really learn from them. So things like cardiovascular risk, depression, risk of progressing with biologics, and whether or not that can inhibit progression are all things that we've been able to glean from this types of research.
You mentioned earlier a little bit about mood with the nurses in your practice, and I mean it just caught my attention because mood's a big part of everything. Maybe talk a little bit about the impact that you see from a patient perspective of the benefit of that.
Yeah, I mean we try to identify it, and then when appropriate, get the family physician or get them connected with someone from mental health. I wouldn't say I'm qualified to address that myself, but it's something that needs to be asked because depression is a lot more prevalent in patients with inflammatory arthritis, and it's something that is not often addressed, and we get swept under the rug. So it's something that we try to at least bring up just to gauge whether or not patients are doing well, and that really impacts their quality of life, their function, their pain as well, right. Stiffness. So if people are depressed, they're going to have more pain.
Anita, do we have anything from the audience? Looks like it.
Do you have any tips on pain management for patients living with spondyloarthritis?
Mm-hmm. I think the first bit is finding out, is there active inflammation? And that oftentimes we're using CRP, blood work parameters, but unfortunately that's only positive in about 30% of patients with spondylitis. And MRI is a very helpful tool in identifying is there active inflammation. And so if that is the case, then probably need to escalate therapy if it's really impairing function and there's quite a lot of symptoms. But another thing just as important as pharmacologic management would be lifestyle management as well. So weight loss, regular exercise, in particular core strengthening is something that often gets neglected. And I get a lot of patients who are active, they're walking and they're running, but not addressing the core strength. And so that can really make a big difference in terms of the pain they feel in the low back.
What are some examples of core muscle exercises?
So thankfully I've got a great physio who can kind of go into the details. Broadly speaking, I mean, there's some basic exercises like bridges and cat-cow. They have some very interesting names. Bird dog. There's certain stretches that can help. But I try to get them to touch base with our physiotherapist, but they also have free or subsidized physiotherapy in BC. So the Maripac Arthritis Centre will see them in some of the hospitals as well. So I try to encourage all patients to at least touch base with them, have a sense of what exercise they should be doing, and then they should be doing it on a daily basis on their own.
Is that it? All right. Well, thanks so much for being here. It's a pleasure to know you, and I think that our future is bright with people like you,
Thank you very much.
next in line. Take care.
Thank you.
Thank you.